In this short video, we will cover why it's relevant to support your workforce that are taking medicines for their health. Let's dive straight in with a case study. Imagine that you are head of department at a school. One of the teachers on your team has recently started an antidepressant medication for low mood. Initially, she experiences increased anxiety and poor sleep. These are known early side effects of the drug she was prescribed, which often improve with time. She tells you she is struggling to concentrate at work due to fatigue and anxiety. What do you do next? We'll come back to this case study shortly, but the headlines of this case study demonstrate how medicines are relevant at work. Medicines used for the management or prevention of ill health are always prescribed with a balance of risks and benefits in mind. All medicines have side effects, and side effects can impact people differently. Even medicines available over the counter for controlling symptoms like pain can be powerful drugs with significant side effects. The case study illustrates that medicines can affect how people function at work. In some cases, medicines can increase risk or vulnerability in certain workplace environments. In 2015 to 16, around 50% of surveyed adults in the United Kingdom were prescribed at least one drug in the preceding week, with around 25% of adults taking 3 or more medicines. It's likely that some people in your workforce are taking medicines. What can make things more confusing is that the same medicine can impact two people very differently. This relates to pharmacology, or how a medicine is absorbed, processed, and cleared by the body. Depending on what else is going on with an individual's health, they may be slower or faster to clear out a drug, for example. This means two people taking the very same drug at the same dose for the same reason can have very different results and different side effects too. When we translate all of that into the workplace, two practical issues tend to be most relevant. Firstly, administration, or how and when the medicine is taken. Some medicines may require injections or clinical supervision, which could affect on-site attendance or working hours. Secondly, side effects. Fatigue, dizziness, anxiety, or reduced concentration can be particularly important side effects in safety-critical roles. Timing is a relevant lever in both of these aspects. Sometimes changing when a medicine is taken or adjusting work hours can significantly reduce the impact of the medicine on the work. So, where should we start with medicines at work? As usual with health and work, the starting point is often open, confidential discussion. If someone's health or medication changes in a way that could affect work, having a confidential space to raise this early helps protect everyone. Modern healthcare treatment is complex, especially when people are on multiple medications. Individualized occupational health assessment is often the safest approach and enables employees to discuss changes in their health and treatment in a confidential space with a clinically qualified professional. In fact, occupational health clinicians can even liaise with an individual's treating clinicians where this is appropriate. So let's return to our case study. To recap, you are head of department at a school, and one of the teachers on your team has recently started an antidepressant. She's experiencing increased anxiety and poor sleep. These are known early side effects of the drug she's taking, which often improve with time. She's struggling to concentrate at work due to fatigue and anxiety. You decide to refer her to occupational health for an assessment. This occupational health assessment identifies that although her mental state has deteriorated slightly since starting the medicine, she is not currently at risk of harm to herself. However, the fatigue and poor concentration she is experiencing are impacting her ability to manage the class effectively at the moment. She's recommended 3-week sickness absence and is reassessed by occupational health at the end of this period. At the occupational health reassessment, she is no longer experiencing side effects, and her mood has now improved. She's phased back into work over 2 weeks, starting with admin tasks and then building up to full teaching duties. So, to summarise, medicines are relevant in the workplace. Encourage your workforce to come forward for occupational health support if they have a change in health or management.